Good evening, respected judges, senior faculties, and my dear colleagues. Today I am here for presenting my research topic on spectrum of renal disease in malignancy. Renal disease in a patient with malignancy constitutes a major source of morbidity and mortality in the hospital setting. A variety of renal disease can be associated with malignancies, such as obstructive uropathies, tumor lysis syndrome, hypercalcemia, as a complication of sepsis, chemotherapeutic agents used in treatment of malignancy. With the advance in the field of onconephrology and inventions of newer therapeutic agents, it is important to know overall causes and outcomes of the kidney disease in malignancy. To analyze the causes and outcomes of impaired renal function in patients with proven malignancy was the aim of my study. It was a cross-sectional prospective study conducted at Oncology Ward and ICU in PPS Lakeshore Hospital, Kochi. All patients with proven malignancy and associated renal function impairment and those who are above 18 years of age were included in the study. Those who are age less than 18 years of age were excluded. These were the operational definition. We define acute kidney injury as an increase in serum creatinine by 0.3 milligram per deciliter within 48 hours and an increase in serum creatinine to 1.5 times baseline, which is known to have occurred in the prior 7 days. Chronic kidney disease defined as eGFR less than 60 ml per minute by using CKD EPA equation that is persisting for more than 3 months or any functional causes that persisting more than 3 months. Tumor lysis syndrome we defined as a hyperuricemia more than 8 milligram per deciliter, hyperkalemia, hyperphosphatemia, and hypocalcemia, serum creatinine more than 1.5 upper limit of normal, which is occurred within 3 days before or 7 days after the initiation of therapy. In this 2 or more of the following, these abnormalities have to be there. Hypercalcemia defined as a serum calcium more than 10.5 milligram per deciliter. There were total of 70 participants who were enrolled in the study. Mean age of participants was 62.9 years, plus or minus 1.2 years. Out of 70, 40 were males. We had 18 participants with a hematological malignancy and 52 participants had a solid organ malignancy. In the hematological malignancy, 8 had a multiple myeloma, followed by B-cell lymphoma, followed by non-Hodgkin lymphomas. 52 participants had a solid organ malignancy, 21 had a GA malignancy, and 31 had other malignancies such as CA breast, CA endometrium, CA ovary, CA lung, renal cell carcinoma. And most common malignancy in our study was CA breast. 65 out of 70 had acute kidney injury, and 1 had a chronic kidney disease. 4 had acute worsening of chronic kidney disease. These are the various etiology of renal function impairment noted in our study. Most common cause of renal function impairment was sepsis, which was seen in 47.1% of patients, followed by obstructive uropathy, and causes like light chain deposition disease, hypercalcemia, rhabdomyolysis, drugs, tumor lysis syndrome, and some other miscellaneous causes also noted. 33 participants had sepsis, among which 19 had a urosepsis, followed by a neutropenia sepsis, and 5 had a pneumonia-related sepsis. Most common organism cultured in blood and urine was Klebsiella pneumonia. And 10 out of 33 participants in sepsis group required dialysis, 5 underwent CRRT, and 4 were expired in this group. 5 underwent intermittent HD, 4 were recovered. Among 16 participants in obstructive uropathy, 10 had a metastatic obstruction, and 6 had a CA prostate. RRT requirement in the obstructive uropathy group, 9 out of 16 had a need dialysis. 1 underwent CRRT and he was expired. 8 underwent intermittent HD, 4 recovered, all underwent degesting procedures. 2 become dialysis and 2 become expired. Overall outcome in the obstructive uropathy group was 37.5% participants were recovered, 12.5% participants become dialysis dependent, and 25% were expired, and 25% partial recovered, that is creatinine stabilized at higher value and not on dialysis. 2 participants had a light chain deposition disease which was associated with multiple myeloma. 1 participant had a partial recovery. 1 participant became a dialysis dependent. 5 participants had a drug-induced renal injury. 4 were recovered, 1 expired. 2 participants had a rhabdomyolysis, all recovered and no HD requirement. 2 participants had a tumor lysis syndrome which was associated with large B-cell lymphoma. 2 required dialysis, 1 recovered and 1 expired. And hypercalcemia also had 2 participants, all recovered, no dialysis requirement. Among chronic kidney disease and acute worsening of chronic kidney disease, 1 participant had which is on maintenance dialysis, malignancy associated was CA breast. And acute worsening of chronic kidney disease was seen in 4 participants, one which CA prostate, CA ovary, metastatic urothelial carcinoma, CA rectum, as well as the malignancy associated, and 2 had a sepsis-related renal failure, 2 had obstructive uropathy, no dialysis requirement. 1 recovered and returned to baseline creatinine, 3 had a partial recovery, slightly stabilized creatinine at higher value. There was a significant association with as a cause of sepsis and dialysis requirement in our study. The overall outcome of the study was there was 28.6 participants were expired and 52.9 participants were recovered and 12.9 participants were a partial recovery, that is creatinine was stabilized at higher value and not on dialysis. 5.7% of participants become dialysis dependent. To conclude, renal failure is commonly seen with malignancy. Major etiology of renal failure appears with sepsis-related acute kidney injury. There was a significant association between sepsis, AK, and requirement of renal replacement therapy. The presence of impaired renal function seems to have a significant association with mortality. Among the survivors with impaired renal function, 65.8%, that is both complete and partial, showed recovery. This is an abstract of an entire presentation in one single slide. Thank you for the ISN South Zone Organizing Committee for giving me this opportunity.